There's no doubt that COVID-19 has posed many challenges, but we are seeing evidence of some countries starting to exert some form of control over it, not least South Korea, which has reported no locally transmitted infections for the first time in more than 2 months. Well, Ros Atkins has been looking at some of the strategies that seem to be working. So what's going right, Ros?
Hi, Kasia. Good to see you. Well, I think we've got to be straight up here. It's going to be many months before we have sufficient evidence to be sure which tactics have proved the most effective in taking on COVID-19. And as we know, comparing countries is fraught given the different ways that data is collected. However, it is clear that some, in these initial weeks and months at least, have had more success than others. So let's start with South Korea, which has just reached a moment of great symbolism. Here's our correspondent in Seoul, Laura Bicker.
Even saying the word zero cases means a lot. They really went after this virus. They were ready for this pandemic. They had a test prepared within a few days of the first confirmed case. The testing, the tracing, and also the fact that they've managed to kind of make sure that anybody who's been infected has been isolated has ensured that they've got it under control, which has meant they can give one-to-one patient care. And that, they believe, means that fewer people have died.
And that phrase, trace and track, is crucial. Some, like South Korea, stuck with doing it. Some, like the UK, began and then stopped it. In the short term, that appears to have been important, given the UK's death toll is far higher than South Korea's, though Boris Johnson today argued his government took the right decisions for the right time. It's also worth remembering that South Korea hasn't shut down in the way that many countries in Europe have done. Here's Laura Bicker again.
Yes, it was part of a social distancing campaign. Yes, a number of places were closed, but restaurants, cafes have remained open. Businesses have been able to trade. It's kept the economy moving, even if it's been more sluggish than before.
Now, this is from Laura too. She tweeted a little earlier, "I find it fascinating that governments around the world are now considering the test, track, treat approach adopted here in South Korea. I wrote this 7 weeks ago," she said. "The example was already there for all to see." And here's the article she's talking about. 7 weeks back, Laura wrote under this headline, "How Trace, Test and Treat May Be Saving Lives." And many experts would now say it has and is saving lives in South Korea. Well, we turn from South Korea to Hungary. It's recorded 300 deaths. That's far below the thousands we've seen in Italy, France, the UK and Spain. It's still far below, even when you factor in Hungary's much smaller population. Well, here's Nick Thorpe in Budapest on some of the measures that were introduced there.
Early on in the pandemic in Hungary, doctors realised that patients were catching the coronavirus actually in hospitals. So they began emptying the wards, at first voluntarily. Patients were advised to go home immediately. Swift government measures and the self-discipline of the population kept infection numbers down. But next week, the government plans to relax some restrictions.
What comes next is going to be an enormous test. Can this epidemic continue to be suppressed if we don't just sit at home, but start to live again? And for a different strategy, a different momentum and strong organisation would be needed. I'm very curious what will happen.
Any breathing difficulties? Feeling of suffocation? Weariness? No? This is a Superman.
In the coming weeks, Prime Minister Viktor Orban will face the biggest challenge of his long political career. Reopening his country for business could cost many lives. How will he explain that choice to the public, and will they believe him? Nick Thorpe, BBC News, Budapest.
Next from Hungary to Portugal, its government is planning to ease its lockdown from May the 3rd, and it too has seen relatively low case numbers and fatalities. Now, one possible factor here is the date that the virus arrives. The idea being the later the arrival, the more time there was for the government to take action, and the lower the impact. New Zealand being maybe the best example of that. It says it's eradicated the virus. Now, this graph is from Politico. It tells us the date the third COVID-19 death was recorded in all of these countries and how long it took for lockdown measures to be imposed after that point. Now, that's a lot of data to take in, so here's a simplified version. You can see the third death was recorded in Italy at the end of February, but it took almost a month more to reach that point in Hungary and Portugal, and by then the governments had already brought in their lockdowns. Compare that to Italy, which took 9 days from the third recorded death to suspend events and 2 weeks more to ban non-essential travel and to close non-essential shops. As one Portuguese government advisor has put it, the difference in Portugal was that we had more time to prepare. Now, in other ways, Portugal reminds us that we mustn't focus on any one factor in isolation. Portugal's got one of the oldest populations in Europe, and while we know COVID-19 disproportionately impacts elderly populations, not so at the moment in Portugal's case. Which leads me to this quote that I saw in The Guardian earlier. Here's the advice from a professor of biology called Carl Bergström. He says one of the biggest things the media could do to improve would be to recognise that scientific studies, especially in the fast-moving situation like this, are provisional. He goes on, that's the nature of science. Anything can be corrected. There's no absolute truth, which is why, while governments, scientists, journalists, frankly all of us are understandably trying to establish what is working during this pandemic, no one, Kasia, knows for sure.
They certainly don't. Ros, thanks so much for that. So there's much more information, of course, on our website.